Well, good evening, ladies and gentlemen. I've introduced myself. For those who've just joined us, my name is Marius Oosthuizen. Welcome to the webinar this evening. It's good to spend some time with you. I'm aware that we are expecting an address by President Cyril Ramaphosa. I've had some information that might be 7, but it looks like it's probably only going to happen closer to 8 o'clock, maybe even later. We will monitor that. If the President does come online, we might interrupt our webinar to listen into his speech. I'm sure we're all waiting with bated breath to hear what he's going to tell us about our lockdown. But in the meantime, we are going to get started here. I see we have about 31 participants who've joined us. We are expecting quite a number more. I should also say that the content of tonight's webinar will be available online after the session. So if you miss out for some reason, you will be able to come back in. And also, please make use of the chat feature throughout the duration of the webinar. Post your questions, your comments. We will make time to circle back to those and have an opportunity for some discussion. I'm going to start off here by sharing my screen. We're going to go on a journey tonight, looking at some of the dynamics at play around the coronavirus disease. And then get into the question of the economic and the social impact that it poses for South Africa and for Africa. A lot of the participants have indicated their interest in the dynamics in Africa, and so we will get into those and explore those together. Please feel free to post your comments, as I've said. We will make sure to bring those into the session a little bit later on. The first point to make, as we welcome a couple of other participants, welcome to those who've just joined us, is that what this pandemic has done is to put the world into what Alvin Toffler, the great futurist, called future shock. Alvin Toffler, a great futurist, wrote this book called Future Shock, and he argued that when change happens at a speed that is faster than what we can integrate, what we can make sense of, that we go into a state of future shock. And so there is a sense that around the world, companies, governments, even individuals, maybe even yourself, you may have found yourself in a state of future shock where you're grappling with a very new reality. Just when we've come to get used to being in lockdown, we're probably going to find ourselves moving out of that and into a very new normal that's going to shape our lives going forward. And so we really are in this state of future shock. Part of the reason is because of an inability to anticipate what this will bring. And so it makes sense to spend some time, as we're doing tonight, to think about what does this mean for the future? What does it mean for the next year, for the next 5 years? And how do we think this is going to affect South Africa and Africa going forward? Over the last few months, the last month and a half really, around the world, people have been in the state of talking about flattening the curve. That's been the obsession, right? From a health point of view, from an economic point of view, we've been willing to make the decision to flatten the curve. But there is a sense that it is time for a shift in mindset. As the economic costs of the pandemic become more obvious, it's clear that we cannot mitigate the disease without incurring major social and economic implications. And so there is a shift taking place in terms of what our focus is, from flattening the curve to a very different environment. Now, what might that look like? This is a slide I shared earlier this week with some of the business leaders working on the protocols that the government will use to open up some of the sectors in the economy. And really what we were explaining to them is that we've been in this mindset on the left-hand side here, where the focus is around prevention and mitigation. It's all about health and the management of health. And you'll see we've used social distancing, we've used the lockdown, we've used testing, track and trace to deal with the health danger. Now, on the left-hand side, the focus of that effort is all around PPE, personal protective equipment for health workers. But we're arguing, and we think business understands this, we think government is beginning to follow this line, that there needs to be a shift towards the right-hand side, where the focus of South Africa, and in Africa the same thing would apply, would be much more about containment of the disease through hygiene, such as sanitizer, through PPE in the public environment. Now, that of course would be very difficult to do. We are seeing in Asia, in the places like Taiwan, we're seeing the use of the entry point sanitizer systems, where if you go into a train station or a bus station, You have to sanitize, you have to clean your feet through a foot bath. We're seeing the sanitization of public space, public transport at large industrial scale. And of course, that raises questions around how we would manage schools and face-to-face learning. We think the health sector, the education sector, should I say, is likely to be dramatically impacted by the need for this form of public sanitation. And so we do think there's going to be a shift to the right-hand side. That's going to put pressure on government and on business, even churches and religious organizations, to think about how they manage health and safety in this new reality. Now, if we step back for a minute from the health problem of the pandemic, and we think about how this has come about, it's useful to observe the dynamics at work in how this pandemic developed. This that I'm showing you right now is a slide that I developed for the US State Department in South Africa. We had a meeting with them where they asked us to do some work on what we think the impact will be of the pandemic in South Africa and Africa. And we said to them, this was about middle of March, we said that the pandemic is obviously started in China, has made its way to Europe and the Middle East and Africa, that it would then go over into the US, and that the US would become the epicenter of the pandemic. We also said to them, if you look at this bubble, that the pandemic would have started on the right-hand side as a supply chain disruption with infections, that's the health burden, and the economic impact in China, in the Chinese factories, but that those two impacts would produce a lockdown and a slowdown in the economy. Now, bear in mind that this was in March, around the 15th of March, that we presented this. And at the time, we could anticipate that as the health burden grows, or the disease burden, coupled with the lockdown and the slowdown in the economy, that this will precipitate both an oil price collapse as well as a currency and fiscal crisis. And we're going to explain in a few minutes why we thought that these outcomes would happen. We felt that this would lead to a sell-off in some of the equity markets. And that raises the question of whether these economic implications will feed back through the system and produce a social and political upheaval or social and political turmoil. Of course, if we look back now, we can see that everything that we anticipated in March has really played itself out over the last month and a half. As we head into May, the economic impact might start to be mitigated, but certainly the social and political turmoil in some countries is likely to endure. And we're going to unpack some of that and get into those details as we proceed. The other thing that we shared in March was that this pandemic would have three waves of impact. We said that the first wave would be the economic impact in March of what happened in China and what happens in Europe. Now, we've already seen that initial economic impact. We said that this would produce a very high level of uncertainty, volatility, supply chain disruption, and that this would have a direct impact on tourism, aviation, commodity demand, and an indirect impact in the medium term. Now, that was in March. We then said that in April, May, it's going to shift over to a disease burden. As the disease burden grows, particularly in Africa, that there will have to be social distancing, and we do anticipate some level of psychological strain across society as households, families, communities are forced into lockdown, high levels of policing. We think there's going to be some psychological strain, and that as this develops, this depends to a large extent on the scale and the rate of infection and the scale and the rate of society's response to those infections. Now, we do think that long-term, and you might ask, what is long-term? But we'll get to that. Long-term, we're going to see adaptive responses by business to supply chain disruptions. I know, for instance, in South Africa, we have some medical equipment, medical masks that have been stuck at the port because of non-essential goods having clogged up the storage facilities at the ports. And so the management of the lockdown and its unintended consequences is going to mean that there's going to be ongoing disruptions, that we would have to manage those disruptions in order to proceed and in order to normalize activity in the economy. Now, when we looked at those waves of impact, this was in March, we said that there were 4 scenarios likely to develop in South Africa and Africa. And we can now see where we are in those scenarios and where we're moving to. The first scenario was that of a storm in a teacup. This was a scenario where there's a very low rate of infection and a very effective response by South Africa and African governments. Now, for the first wave of South Africa's infections, we do think that we've been in this left-hand scenario, which we've called a storm in a teacup. But as the first wave of infections move through the society, and we're now seeing community transmission, particularly in high-density, low-income communities where lots of people live together in high density, but don't necessarily have the space to do effective social distancing, we do think we move over into the second scenario, which might look like Africa spared, like the majority of the impact has missed us, but we're at risk of moving down into the left-hand corner of a perfect storm. We do think that South Africa's very proactive approach in acting very early in the pandemic has meant that for now, we've avoided the perfect storm. We've been quite effective at doing that, but it remains to be seen whether specific communities can avoid a perfect storm. I know from work that I'm doing with distressed communities in food security that there are many communities who have no social distancing. There's very little face masks. There's very little hand washing or sanitation taking place. And so my forecast at this point would be that by the end of May, some South African communities, some suburbs, and particularly low-income communities, will be in what I've called the perfect storm. And some South African communities will be in this environment of Africa spared, where they move beyond the pandemic and sort of have a new normal, where they're wearing masks, they're going about their business. And this starts to drive really two very different realities in South Africa around what this pandemic means and what it looks like. And it's probably true in Africa, where you have similar levels of inequality across those societies. Now, these four scenarios, we said at the time, would have specific consequences if they were to develop. If the storm in the teacup scenario remained, which is a low level of infection, we said that the infections would be under 1,000, public hospitals would handle the outbreak, there would be a slight recession, but really isolated deaths and negligible political fallout. But as we move from this storm in a teacup scenario to the Africa spared perfect storm scenario, you can see the worsening economic and social impact. And this was in March when we said that if we move into an Africa spared perfect storm environment, we're likely to see isolated breakdowns in the social contract in South Africa. We're likely to see conflicts between community members who have very limited resources. And in the economy, we're likely to see a fiscal crisis with currency devaluation. Now, you can see, if you look at the photo here on the left-hand side of the looting of a Checkers truck earlier this week, there have been a number of these incidences. We do foresee that as the pandemic worsens, as the lockdown continues, that we will move further from the red, further from the orange into this red zone of more severe economic fallout, and we'll get to what that looks like and the mitigation measures, more severe social breakdown, and of course, that might lead to a backlash in the political environment, particularly in countries in Africa where the government is fairly weak, where there's lots of criticism of government. And so we do see that as the main trajectory. Now, early in the pandemic, there was some expectation that possibly the climate in Africa might mean that the pandemic spreads through Europe and the US, but that Africa is to a large extent spared because of the climate. In that environment, the view was that the pandemic might spread as the winter arrives by July, particularly into southern Africa, but that Central Africa might be spared because of the climate conditions. I can say with confidence, having looked at some of the research, that the coronavirus is shown to survive in 36-degree temperatures for up to an hour. And so it's very unlikely that the climate is going to prevent Africa from experiencing the harsh impacts of this pandemic. What we are going to see, more likely, is that a similar pattern plays out in Africa as we've seen in Italy, Spain, and possibly for some African countries, as we've seen in the US. The only mitigating factor that could prevent that would be if there's a medical cure. There are the prospects of a vaccination, of some therapies, but we think those are about a year away. And so some countries in Africa and some communities in particular are likely to see themselves on this left-hand side of this graph, where there's a breakout in infections If we look at the case of the US, as of tonight, the US has almost 1 million infections, 800,000 infections, almost 50,000 deaths. Of course, the worst hit was New York, and that's largely on the back of a very slow response in the US. As the US went through this crisis, they progressed to a point where up to 60% of the US is in a lockdown environment. We do think this number of deaths in the US is likely to go up to about 75,000. And that's with the full might of the United States economy and healthcare system behind them. And so you can begin to imagine, if we look at Africa, if countries in Africa, of which South Africa leads the charge, begin to see their numbers go from a few hundred to a few thousand, that there is very likely to be a breakout in those countries into the thousands. And what that would mean then at a global level is that the pandemic would spread from China, Europe to the US, but would come to Africa quite late in the process. And the same could be said of South America, that Africa could be the first to get the economic impact because of our dependency on China as an export region to where we send commodities. So we could have the first economic impact, but we could have the last disease burden impact. And so really a double whammy or a double impact for Africa in that sense. Now, why is it so likely that Africa is going to see a high level of impact? Work that was done by the University College of London shows that the moment a person gathers in groups of 10 or more, their risk of infection goes up. And the moment they're in a country with 100 or 1,000 cases or more, their risk of infection goes up. And so in the case of an African country, where thousands of citizens are living in close proximity in squatter camps or townships, to give you a sense of that, 60% of Africa is informal, 65% live in cities. And so where you have large African cities, the moment that we get over 1,000 to 10,000 infections, we very rapidly raise the risk to 90% risk of infection. And so as we saw from the study done in the UK, instead of lowering the curve or flattening the curve, as we say, we then see a surge in the need for hospital beds, critical care beds. And as we know, Africa's health system is very simply not in the position to compensate for that kind of health burden. Now, it's not all bad news. There are some good news stories coming out of Africa. And I'm going to take a minute here to let you listen to Dr. Mike Ryan, who's the executive director of the World Health Organization, talk for a minute about the conditions on the ground, particularly in South Africa, and how South Africa and African countries are responding to the pandemic. Let me give you a minute to listen.
Mike. So again, there's a tremendous amount of innovation going on in Africa in general. Maria mentioned South Africa, and again, it is interesting the way in which South Africa is bringing the disease under control, and how African countries are actually, in many ways, in some ways, showing the way. The strategy in South Africa was based on preparation, primary prevention, lockdown, and enhanced surveillance. 67 mobile lab units around the country, 28,000 community health workers trained in case detection, and I think over 120,000 tests completed with a 2.7% positivity rate, which is incredible, that much testing for that return. So we're seeing performance levels there again, congratulating the government and institutions.
So really some great work being done in South Africa by the South African health authorities. And the way they've been able to have that success is really by using a combination of testing as well as what they call screening. So our health workers are going into communities, they're meeting with communities, they're screening them, they're taking temperature, they're looking at the throat, whether there's infection. And the moment they see any signs of a throat-based, lung-based infection, they're moving those individuals out of the community, they're having them tested, and in that way, they're able to mitigate the spread. Now, having said that, if we look at the statistics and the curve, we do think that even with that very effective strategy, South Africa is likely to only now see the rise of their curve. The early curve in South Africa really was the high income earners who were traveling to Europe. We're now seeing the start of a curve of South Africa's working class and the poor. And we do think that that will accelerate. We are seeing that in the numbers, and that to the degree it accelerates, the health burden will increase. And of course, that will constrain us in terms of our ability to open up the economy. Now, I want to move now to the economic side of the pandemic. Please let me encourage you to make use of the chat box on the platform to ask questions, to make comments, especially when I get into the economics. If you have specific questions you want to ask, please feel free to ask them in the chat box, and then we will circle back to those questions a little bit later in our session. Now, when we move to the economic side of the pandemic, the story begins to get quite serious for Africa. And this is because of Africa's particular economic vulnerability. To understand the economic impact in South Africa in particular, we have to take a step back and talk about the conditions in South Africa prior to the coronavirus pandemic. So what was happening in South Africa's economy in this early stage prior to the end to the pandemic? Really, South Africa was on what we would call the road to Argentina. Argentina has been in the last decade through a series of defaults on their sovereign debt, worsening currency, low levels of growth. And the reason for that is that they made similar mistakes to what South Africa has made in the last decade. What we've seen in South Africa is a combination of rising government debt with policy inaction. And so that rising government debt with policy inaction, the inability of government to respond adequately to the policy environment and make the tough decisions, with the embattlement of South Africa's NGO sector or SOE sector, the state-owned enterprises, Eskom, Transnet, PRASA, combination of mismanagement, of poor capacity, of over-indebtedness in those SOEs, with the debate of land rights in the context of the land reform policy. All of these conditions over time have led to the worsening of South Africa's policy environment outlook. So the worsening of the economic expectations in the economy, where investors are saying, we think things are likely to get more negative. What that has done over the last decade have driven down the GDP growth in South Africa, the gross domestic product. Now, when you lower the country's GDP, what you do is you lower the revenue of the country. You lower the tax that the country is able to obtain. And when you lower the tax that it's able to obtain, what that does is it creates a larger fiscal gap. In other words, the country is not in a position to pay the expenses that it has committed itself to. We see this in the public sector wage bill. We see this in health expenses, education expenses, and then, of course, the servicing of our debt. And so the inability of government to grow the economy leads to less revenue, which leads to a fiscal gap. And when your deficit, the deficit is the gap between what you're spending versus what you're earning in terms of revenue, when that deficit grows, what then begins to happen is the ratings agencies begin to downgrade. And so what's happened to South Africa, in addition to the pandemic, has been the downgrading of South Africa's economy to junk status, or to our sovereign bonds, our state-owned enterprises to junk status. Now, the downgrading of South Africa to junk status is going to have two effects. It's going to mean that capital markets, financial markets outside of South Africa, will be unable to put capital into South Africa at the same cost that they've done previously. And what that is going to do, it's going to increase the borrowing costs in South Africa. It's also going to lead to the weakening of the rand. Now, we've already seen that. We've seen the rand weakening substantially. And so as the environment weakens, which is this upper environment here, that drives down the value of the rand, and it drives up the cost of borrowing. And ultimately, the way that comes through to the average consumer is through what we call import inflation. And so in a year's time, in 2 years' time, the cost of living goes up because of that import inflation. That's good for exporters, except for those who require equipment to do their manufacturing processes or inputs into their manufacturing. Now, how does South Africa get out of this trap, this debt trap that we're in? The bottom line is we need to have what we call growth above the population rate. So unless we're growing at 5% or more, we need to have that growth that produces employment. So that growth has to be employment producing growth. And we need to secure property rights and good governance, because those create the conditions for the country's success. Now, what I want to do for a minute here is pivot to a colleague of mine who teaches with me at GIBS, the Gordon Institute of Business Science. Dr. Adrian Saville, or should I say Professor Adrian Saville, is an economist in macroeconomics. I've asked Adrian, as well as a handful of other colleagues around the world, to send me their input into this webinar tonight. Adrian has sent this for the sole purpose of this webinar. And so I'm going to give you an opportunity in a second here to listen to what Professor Saville has to say about South Africa's economic environment. And then we're going to turn our attention to Africa and talk about the long-term impacts in Africa. Let's listen to what Adrian has to say.
At the start of this year, the IMF forecast that the South African economy would grow by 0.8%. Whilst anemic and below the population growth rate, that number was at least positive. Since then, the impacts of the COVID-19 pandemic have led the IMF to substantially revise their forecast for the South African economy downward to a decline of 5.8%, an unprecedented figure. The revision on economic growth has also been met with revisions in other macroeconomic indicators, such as the budget deficit, which now looks like it will comfortably come in double-digit territory, a hiking in debt-to-GDP ratios, and two ratings agencies, Moody's and Fitch, have both taken South Africa down a notch in their assessment of creditworthiness. The impacts go beyond economic growth numbers and manifest most obviously in newly unemployed and business stress and failure. By some estimates, as many as 1 million jobs might be lost in the formal sector and 5.5 million jobs lost in the informal sector. Let's put South Africa in a circumstance where we desperately need material stimulus. And indeed, these policies have taken shape with the form of more than 2% interest rate cuts behind monetary policy and a 500 billion package announced by the president to stimulate spending, bring confidence, and afford critically needed social relief. Unsurprisingly, this money isn't available internally given our fiscal circumstance. And so South Africa will be obliged to turn to multilateral lending agencies such as the World Bank, the IMF, the African Development Bank, and the BRICS Bank, the New Development Bank. What is even more critical is that in reaching for this external funding and announcing these substantial stimuluses, is that South Africa also reaches for the sustained stimulus of structural reform. These already have shape in the form of Tito Mbowene's 77-pager. The key point is that these reforms now turn from promise into practice.
What I would like to do at this point is to welcome a participant in our webinar tonight. Dr. Jakkie Cilliers is with us on the call. I'm going to end my slides here for a minute. Dr. Cilliers is the co-founder of the Institute for Security Studies. Jakkie has worked on Africa and African issues for many, many years. He's now the executive director of the Center for Innovation and Foresight, or Futures, at the ISS. And he's recently written a book called Africa First. Now, I invited Jakkie to join us because his book covers really the long-term impacts in Africa, the long-term trajectory of Africa across a whole number of different dimensions. And so, Jakkie, what I want to do is welcome you here, give you the floor for a minute to talk to us about your book and frame for us the coverage of the book so that we can talk about what this pandemic is likely to do on the continent. Over to you.
Thanks, Marius. I just want to make sure that you can hear me.
You're loud and clear. Thank you.
Okay, thanks very much. So, Marius, this is the book that I wrote, Africa First, Igniting a Growth Revolution. I've got a nice quote from President Ramaphosa on the front cover. The book came out just ahead of the COVID crisis. And the first question that I'm always asked is, what does COVID do on the forecast? I'll get to that in a few seconds. Basically, what I've tried to do is I look to where Africa is currently headed out till 2040. I use a massive computer-based forecasting platform hosted at the University of Denver, where I spent some months for the forecasting. And then I look at various transitions in Africa. So what would improved education, do to the future of Africa? What would advancing Africa's demographic dividend do to the future? What would an end in conflict do? What would improved governance, the implementation of the African Continental Free Trade Area, and so on and so forth do? There are 11 of these chapters, and I also look at the impact of climate change and the future of jobs or work. So I take a long-term perspective, and the reason why I do that is if you look back to 1960, the time of independence in Africa, the gap between average income levels in Africa and the rest of the world has been increasing since independence. Things are improving in Africa, and they are improving probably more rapidly than many suspect, but they are improving more slowly than in the rest of the world. And the question that the book tries to answer is what can be done to close that gap? Now, obviously, COVID, and that you're speaking about, has a huge impact on those prospects. But when you look long term, as I do, looking out till 2040 and looking at what needs to be done, the impact, of course, is reduced. At the moment, it feels like an all-consuming crisis. But 5, 4, 6 years from now, it will look very, very different. So that's a summary.
Jakkie, my second question to you is, of course, your book looks across a number of different dimensions, and we're going to share the link to the book in a second here for those who want to explore it, maybe have a look at reading it. But it looks across a number of dimensions. You have commented that you were surprised at the impact that health, as well as things like basic infrastructure, are going to have on Africa's trajectory. Now, we're going to get back to that in the context of COVID's impact, but why would you highlight those two areas of health and basic infrastructure as key enablers of development, or the lack thereof?
To understand where Africa is going, you have to understand where it has come from and where it is. The growth of cities in Africa was largely enabled by modern medicine. It was not enabled by the provision of water and sanitation, as was the case in much of the developed world. So urbanization in Africa, which only started at the end of the 19th century, expanded rapidly, but different to Europe and North America, where urban communities had to manage their urbanization through making sure that there is basic health care, running water, sanitation. That is not the case in Africa. And we see very rapid urbanization in Africa, but it is urbanization that is not because there are jobs in the urban areas, but because people are escaping poverty in the rural areas. So you see large slum areas around most of Africa's urban areas, and these are potentially health hazards. So there is no shortcut to development. And one of the areas that Africa has to invest in is to invest in the basic infrastructure that is required for more rapid urbanization. So from that perspective, and we have done a number of country studies across Africa, it's very important that you fix the basics. And one of these basics is just simply the infrastructure that can provide people with the ability to lead a healthy and productive life.
Jakkie, my final question to you, and as I said, I will share the link to the book shortly for those who want to explore it, is we're now seeing in this short-term environment, the negative impact of this pandemic, not only on the health side, governments in Africa having to cope with that, respond to that, but also on the economic side. And these governments that in many instances are already embattled by a lack of finance, a lack of growth in the economy, a lack of stability. Now they have this additional burden of having to manage the health as well as the economic burden. What do you think are the key policy or governance interventions that are going to see Africa through this process?
You know, one of the areas that I explore in the book is the relationship between democracy and growth, which is one in our world that we work a lot on. And generally, we would like to believe that democratic countries grow more rapidly than other countries. Unfortunately, at low levels of development, in other words, in poor countries, that's not that important. Whether you are a democracy or an autocracy, what is much more important is the orientation of the governing elite. And if you have a coherent governing elite that focus on the development of that country. So there are many things that Africa needs to do to respond to the COVID crisis. And there's a lot of focus at the moment on flattening the curve and all of these kind of measures. But it is still very early in the COVID crisis. And because Africa has such a much of a younger population, the median age in Africa, which means half of Africans, are younger than 19, almost 20. The other half are older than 20. The median age of South Africa is about 26. The median age in Europe is about 45. The US is about 41. Because we have a much younger population, we don't know how COVID is going to impact on Africa, but we have other problems. We have, for example, a high burden of communicable diseases in Africa. So these issues make it very difficult really to confidently forecast where Africa has to go. Clearly, we are all hoping that there will be some time of vaccine within the next few months, maybe available sometime next year. But the most important thing which South Africa has done very well is effective communication and evidence-based implementation. So the president, who later tonight is again at 8 o'clock, I think, again speaking to South Africa, has been exemplary at this. We are struggling with implementation. We don't have the kind of health system, and we cannot in Africa implement the kind of individual isolation policies that you see in Europe. You cannot expect poor people in slum areas to somehow stay away, to not earn their living, or to stay in a room. It's just not possible. So education and community mobilization by community and religious and other leaders is hugely important. And that is what is going to take Africa forward. The danger, of course, is in our urban areas, but also because Africa is more rural and less urbanized than many of the rest of the world. There is sort of ways in which we perhaps have a degree of more protection than many other areas that are highly urbanized, connected. We are not that connected. So this interplay can provide, makes it impossible at the moment, really, with confidence to forecast what is going to happen. But clearly, leadership and example and community engagement and education are the most important things.
Dr. Jakkie Cilliers, we thank you for your time. I did post the link to the book. It is available on Amazon in the chat section. Please feel free to go ahead and have a look at that. It will provide an extremely valuable backdrop to this conversation about what COVID's impact will be on the continent. With that, I want to move back to our economic story to reflect on what this might mean going forward. The focus of his comments were really about South Africa's downward trajectory in terms of economic growth and the inability from a financial point of view, from a fiscal point of view, for South Africa to provide the stimulus to get out of that low growth. And so that means that South Africa at least has to go outside of the country to find the liquidity. Now, some have equated this current crisis with the global financial crisis. They've said it's a similar crisis. There is a key difference. So in 2008, 2009, the nature of that crisis was that it was first and foremost a crisis in the financial system, the global financial system, and this led to a dry up of the liquidity in the global financial system. That liquidity crunch was resolved by the federal government in the US by, for instance, putting liquidity into the economy by giving to banks and saying to them, release your lending regulations and get that liquidity into the real economy. And that boosted the real economy growth in the global financial crisis, and really through a combination of measures moved the economy out of recession and back into the growth environment. The difference with the pandemic is that instead of impacting the financial system first and then liquidity and then the real economy, the virus has brought about a health burden, but really a fairly small health burden in the context of South Africa and Africa. It's only in a few hundred in Africa, in African countries, only in a few thousand in South Africa. But because of the lockdown has led to a major contraction in the real economy. And this has led then to a massive uptick in lending. Now, around the world, at the global level, the impact of this, of course, has been dramatic. We did forecast, if I step back for a minute, in March, we forecast here that there will be a collapse in oil prices as a result of the pandemic. We have now seen that collapse. We did not quite anticipate the scale of that collapse, but we see here at one point oil dropping below $1 a barrel. Basically, oil producers paying refineries, paying storage facilities to take the oil off their hands. That's recovered somewhat. Now, the question, of course, that raises is why did the oil price collapse? And I'll read you a comment here by Bloomberg. Since the IMF issued their forecast of a -3% global growth, oil price futures are trading in negative territory. What that means is that because of the low levels of expected demand in the global economy, because of the severity of that drop in demand, the value of oil, of course, collapsed. Now, oil is a very powerful, useful proxy for actions, behaviors elsewhere in the economy. If we see this kind of collapse in oil prices, this is very dramatic. We're likely to see a similar, not as great, not as deep, but certainly a similar contraction in the value of other commodities as the real economy comes under pressure. Now, how does that work if we think about it as non-economists looking at the system? Essentially, you have your financial system here at the top. This is government, central banks, your money market, your capital market. They feed those inputs, that money, that liquidity, into the financial markets, your commercial banks, your investment banks, insurance companies, brokerage firms. Of course, they also receive savings from your consumers at the bottom, households, who put their savings into these banks. And what then happens, the combination of the financial system and the financial markets enable the real economy to borrow money to invest and enable the equity markets to trade. So your stock exchange, your investments through your pension fund in equities takes place here in this level. Now, what we've seen with the coronavirus pandemic is that the initial impact of the pandemic was down here. It was a health impact on households, but that impact is fairly small. And it does seem likely that for the medium term, for the short term at least, the impact of the health burden in Africa will be fairly small. But the impact in the real economy, because of the shutdown, has been immense, not only in domestic African economies, including South Africa's, but in the economies outside of South Africa where we sell commodities to. Now, what that has done is that has led to a major slowdown in the bond markets, in the equity markets, and that has led to a shrinkage essentially of individual savings. Their savings decline because the real economy is not moving, and because the savings decline and the real economy is not moving, what government has done is really come from the top here and produce a stimulus package that is going to put more liquidity into the system. The difficulty, of course, is South Africa's government, as many other African governments, will have to borrow this money. Now, what does that mean long term? Essentially, what that means is that unless African economies, including South Africa, can raise the level of productivity in their economy and aggressively raise the level of their economic growth, what's going to happen is their debt levels are going to grow at a faster pace than their revenues can sustain. And that raises the risk of a credit default. To make that point, I'm going to go once more to a colleague of mine, Ronak Gopaldas, a colleague of mine. He's a South African based in London, has given us some comments on what he sees the political economy impacts being across Africa. I am going to try and make it as loud as possible. If the audio isn't good, let me confirm that I will share the transcript and the audio with you after the session. But let's listen into what Ronak shared with us for tonight.
So the first issue that concerns me is the issue of African sovereign debt. This is something that is really generating a lot of alarm because African countries have been hit by a triple whammy of factors. They've had crisis of confidence and capital flows have stopped. They've had currency depreciation and then falling commodity prices. And as we know, most economies on the continent are not diversified and they have very narrow revenue lines. So what this has done is put pressure on the cost of funding. We've seen yields on the Eurobonds of a number of countries rising dramatically. Zambia is currently sitting north of 65%, which is clearly unsustainable. And a lot of African countries are now having to make the choice between paying external creditors who they borrowed from, or do they spend these fiscal resources, which are quite limited, on saving lives and putting it into healthcare systems and dealing with this pandemic? So that's the first issue. I think we're heading for a tense standoff between private creditors, multilaterals, governments, and African sovereigns. There seems to be some conciliatory sentiment and actions coming out from international lenders, but I think it's quite clear that we either need to see debt relief or a debt moratorium, because otherwise you're going to have a humanitarian and economic catastrophe on that front. The other issue that I'm watching quite closely is the issue of China. How will Chinese and African relations evolve going forward? There's a bit of tension now with African students and the likes being attacked in China, and will there be xenophobia and resentment towards China? There's some talk around reparations instead of aid. So I think China has historically been the preferred partner for African governments. Will that continue in the future, or do they have an image and a PR problem that they're going to need to rectify? What does this mean for the Belt and Road Initiative? These are some of the questions that I'll be watching quite closely on that front, because I think the geopolitical equation is shifting, and whether China will still be as relevant to Africa and vice versa in the future is going to be an interesting space to watch. And then finally, from a political economy perspective, there are a few big questions. Elections due to take place on the continent this year, are they still going to happen? Are they going to be postponed? We've already seen postponements in the likes of Ethiopia. We're meant to have Cote d'Ivoire, which is another big economy. What's going to happen there? The Continental Free Trade Agreement is another aspect. Is this thing going to be aborted? Is it just going to be delayed, or is it going to create increased impetus for regional integration and collaboration amongst African states? I'd
like to switch here to my colleague Geci Karuri-Sebina. Geci is a fellow futurist. She comes from Kenya, but lives in South Africa and works widely with the public sector for some views on what she thinks the impact of this will be on Africa in economic terms.
Hi, my name is Geci Karuri-Sebina, and I'm commenting on future implications or lessons from COVID for Africa. I'd like to begin by a question posed by President Paul Kagame, among others, and it goes something like this. Why do we produce what we don't consume in Africa and consume what we don't produce? I think one of the things COVID has exposed are the economic illogics in this regard, but what it also exposes are the opportunities economically to reconsider issues of local production, of circular economy, of distributed manufacturing, all of these things that we've spoken of. However, what COVID has also exposed is the weakness of our institutions. So in spite of long-held conversations and efforts around democratization and decentralization, in fact, what's been exposed are our stronger centrist tendencies and our great difficulty in mobilizing institutions and actors locally to really have robust innovation ecosystems, to increase and ensure access, to have strong institutions of governance and the kind of arrangements that would enable us to take advantage of some of these opportunities. So the area of strengthening local institutions becomes really a very key focus area for the future, and a lesson we really ought to be taking out.
Now, with Geci's inputs as background, I want to move to a view of the broader economic impact in terms of countries' vulnerability compared to their health system capacity and how they would be able to handle these impacts. In this early in March of the state of economies in Africa that are particularly vulnerable to this combination of a low oil price, slow growth around the world, a collapse in commodity demand, and identified that list of countries on the left-hand side here that are likely to be most affected in the short term by the pandemic. We then cross-reference that with countries that have a very poor capacity in their health system. Some countries like South Africa having 4 beds per 1,000, 4 to 6 beds per 1,000, but some countries in Africa like Mali, for instance, having 0.1 bed per 1,000. And so when you look at those two impacts, the economic with the vulnerability of the health system, you can see here across the diagonal in Africa, really the countries that are at the highest risk of a negative impact from the pandemic. And so those would be the countries that are most likely to be affected. We do anticipate that those effects will be largely economic that the economic impact will by far eclipse the social and health impact, especially if a cure is found or a mitigating factor is found, such as a treatment that prevents the disease from spreading. If that happens, then we think South African countries can be spared from the health burden, but at this point, that is unlikely to be the case. One final comment to make, and this ties into what Jakkie said earlier in his presentation, that if we look at the spatial dynamics of African countries, and this is true not just of South Africa, but across the continent, it is really this combination of inequality and high density in cities that is Africa's biggest challenge in the context of the pandemic. If I pause for a minute on this issue of cities, I've asked a colleague of mine, Prat, who's a fellow board member of the Association of Professional Futurists. Prat is based out of Asia, to give a view on what Asian cities will have to think about in this context. And there would be some lessons for African cities as well as we reflect on this urban impact.
Hi everybody, this is Prateeksha. I am with the UNDP's Asia Pacific Regional Innovation Center. As you might know, UNDP works quite closely with local government counterparts. So much of what we're following has to do around governance and governance styles, the narratives, the different ways in which we're dealing with the pandemic across the region and the implications of that in terms of what we might see. I'm personally also looking at other things such as our cities and their identities. Asia has some of the most densely packed cities in the world, and they feature, day markets and night markets that until pre-COVID were some of the biggest attractors to tourists in the region. So suddenly, now the very things that attracted people are things that might detract people from coming to our cities post-COVID. And so I've been sort of thinking a lot about what does that mean for us? What does that mean about our cities' identities and our culture, the way that we define ourselves, and the way in which that definition and cultural identity has shaped our economic models. And the implications of that are wide, not just economics and equity, but also gender. And so, then as a flow through to that is what are the things that might possibly creep in when these economic infrastructures are sort of, pulled from under our feet. There's a possibility of organized crime really taking in, which has mobilized resources and many times the cultural and sort of local networks, to really mobilize where other things have fallen short and where governments can't respond to as promptly and quickly. But there's also the opportunity not just to look at all the things that could go wrong, but also all the positives and ways we can mobilize ourselves as a community to look at the ways our SMEs are structured. How can we, look at the new models of ownership? How can they become cooperatives? How can they become things that are sustained by the community as opposed to being stripped from the community? And looking at our SMEs as having latent capacity that can be activated with some ingenuity and some innovativeness. So, just some thoughts that are emerging in terms of possibilities, but also opportunities.
This is an example of this vulnerability in the context of Johannesburg. This is the city of Johannesburg. The red areas are both the most highly dense as well as the most income insecure. And so what this pandemic is going to do is it's going to expose, on the one hand, those that have very low levels of social distancing, very poor abilities to do social distancing, as well as a high level of vulnerability in economic terms. If you're not able to earn an income, a livelihood in the informal sector, you're most likely to see the impact of the coronavirus pandemic. What that means for Africa, of course, in the short term, is rising levels of poverty, rising levels of unemployment, rising levels of food insecurity, and those are likely to put pressure. Someone picked up there, Gerrit, thank you. That is in fact Gauteng. It was done by the Gauteng City Region Observatory. That part in the center there is the city of Johannesburg. That really we're going to see a number of these social indicators increase, the negative social indicators, and that is going to put pressure on the economy in terms of distribution, but it's also going to put pressure on government from a policy and public sentiment point of view, where the governments are able to sustain their license in communities where these kinds of pressures are rising. And we are seeing some of that in South Africa as we stand. I'm aware that we have about 10 minutes remaining. I'm going to pause on my slides here for a second. and open up for some comments. There have been some comments in the comment section, but what I'd like to do is to invite participants to pose a comment. While you're thinking about that opportunity, I did see a comment earlier here by Peter Tarantal, who asked the question, how do we balance the twin challenges of poverty and COVID-19 on the continent? I don't know in my mind whether these two challenges can be balanced. My sense is that they are really intertwined, that to the extent that the pandemic worsens, poverty is going to worsen, and the solution both to poverty and to the pandemic really is inclusive development. And so to the extent that we have inclusive development in economic terms and improvements in our health system and improvements in our socio-economic environment, that will mitigate both the pandemic as well as the question of poverty. I'm going to ask Dr. Cilliers, I see he's still on the call, if he wants to come in addition to that comment with any feedback on that question. Jakkie, let me come to you for a minute before we take other questions.
Thanks, Marius. I think you've nailed it. I think that the essence of Africa, the challenge that Africa faces, that we have extraordinary high levels of inequality, particularly in Southern Africa, and that we are not growing rapidly enough given Africa's rapid population growth. Africa needs economic growth rates of excess of 10–12%. And our forecast for the average rates of economic growth for all of Africa is about 4.7%. COVID is going to hit that quite hard. So if you look at a forecast of what is going to happen with poverty in Africa, most of you would know that the Sustainable Development Goal 1 is to eliminate extreme poverty by 2030. Now, it is almost impossible for Africa to achieve that. We have to grow at about triple the rates of growth that Africa is growing with at the moment if we are going to be able to eliminate poverty by probably 2035. So the issue of poverty and income growth, it all relates to the issue that you're speaking about, Marius, and that is inclusive growth. And you only get inclusive growth if you can change the productive structures of your economy. And to do that, you need to move people from the informal agricultural sector ideally to manufacturing. Africa has to undergo an industrialization and all the other things, including a demographic, advancing its demographic dividend that I think you and I have spoken about many, many times.
Thank you, Jakkie.
Marius, this is Peter.
Go ahead, Peter.
Yeah, I suggest that you read the comments. Let me pick up on the comment that Andre Kibido just posted. How will the pandemic affect the Africa Free Trade Agreement that is pending? Yeah,
thank
that
you,
is
Peter.
pending.
That's a great...
So, yeah.
That's a great question. Thank you for you and Andre for that question. We're going to come to that. We'll take another question. I see someone here has a hand up. Please go ahead.
Hi, Marius. I'm not sure if that's my hand. It's Chimera from the Helen Suzman Foundation. I just want to touch on something that Jakkie said earlier, and it's about this commendation for effective communication and evidence-based implementation. Not to be the cynic on this chat, but I'm not sure about that, because I think what's becoming clearer in the South African context, at least, is that the reasons why the executive is taking certain decisions in its health-based approach and its economic approach is not entirely clear, I would say generally, and I'm speaking very much on behalf of like civil society networks trying to be interlocutors between policymakers and communities. Because at the end of the day, and I think this was the point made earlier, you ultimately need the buy-in of communities to understand why they need to comply with certain policies, and that rationale, I'm not sure is as widely accepted or understood as it needs to be.
Thank you for that comment. And just by word of explanation, the reason my name is appearing is you may have joined with a link that is my link. So I see there's a few of those in the room. Thank you for that comment about the need to clarify and communicate the rationale for policy choices. Others, open up your microphone. Feel free to post a comment and we'll get some answers and reflections. So if there are no additional questions or comments, I think to respond to those first two, the question of the Africa Free Trade Agreement, Ronak in his audio that he sent us addressed that to some degree. And when I share the online version of the webinar, I will include Ronak's comments. But the difficulty, of course, is for the Africa Free Trade Agreement to succeed would require major changes in the friction across the African continent. So the operational logistical challenges to trade taking place across the continent, things like petty corruption, things like infrastructure improvements, the reform around the management of logistics across the continent, the agreement on trade between countries, all of those barriers to trade would have to be removed. And of course, in the short term, the pandemic creates additional barriers to that. It undermines the movement of people. It undermines the ability of countries to expand their connectedness in a physical sense. And so it is likely to delay in any meaningful way Africa's trade. The only path out of that I can see is either through the trade in services, business, technology, ICT, and other technology-based virtual services, which of course are not subject to the pandemic in the same ways. And then of course, large-scale commodity trade between African countries, perhaps by sea, by way of harbors. There is an opportunity to expand that in spite of the limitations of the pandemic. I don't know, Jakkie, I'm going to come back to you in a minute if you want to add something on the question of the Africa Free Trade Agreement. Maybe one comment on the question of government's policy response. There is a sense in which South Africa was very proactive and effective, but in a very narrow sense, focused on the disease problem and their response to the disease problem, and that perhaps the time is now for South Africa to take a more expansive approach to how it deals with the disease on a medium and long-term basis. And I would agree with you that possibly a large portion of the population would not have felt that they were taken into government's confidence in understanding the rationale for that decision-making. Having said that, I have seen high levels of support for the president. It does seem that in an unintended way, the crisis seems to have strengthened his hand and his legitimacy. Jakkie, on those two, any comments from you?
Yeah, Marius, I think we're all hoping that what has happened with COVID, decisive government action from the executive will also translate into the broader economic sphere. And many of us have commented on this, and government has made it clear that they're going to seize this crisis to also advance South Africa and to make a reform on the many urgent issues and step away from some of the hindrances like nationalization of the Reserve Bank and land reform without compensation, which really are dragging South Africa down. The African Continental Free Trade Area is something that's a long-term ambition. You know, the agreement that implements that is that full implementation will only be achieved by 2035. There are many challenges, but if Africa does not integrate from a trade perspective, it will never grow. Just think from about the size of the domestic market in the United States, in Europe, in India, and China. We have to create a large enough domestic market in Africa that we can trade with one another, and that is the best way to increase the value of goods, and therefore to go up the manufacturing value curve, and therefore to change the productive structures of Africa's economies. So very important, and the modeling that I did for Africa First, in actual fact, indicates that the implementation of the African Continental Free Trade Area over a long time horizon will be tremendously beneficial for Africa.
Dr. Jakkie Cilliers, I want to thank you for giving generously of your time to contribute to our discussion. And participants, thank you for joining us. We apologize for the tentative reallocation of the time due to the President's address. We did receive communication earlier that he had planned to speak at 7, but it's now been set for 8:30. He does seem to have a habit of doing this to us. And so we are going to end our webinar shortly, but let me say that, as I've said, the recording will be available. We will also create future opportunities such as these to engage on these kinds of economic issues. I would like to reiterate my earlier point that Dr. Cilliers' book will be a valuable resource to those concerned about the trajectory of Africa in particular, So Dr. Cilliers and I will also be working on a project looking in more depth at the impacts of the coronavirus in Africa. And so with that, I want to thank you for joining and participating. The recorded version will be available online and will be sent to you via email to each of you as a registered participant. You will receive a link via email. And so we will make sure that you receive that. I see there's a question from Etienne. I see there was a hand there from Peter. Peter, did you have an additional question?
Peter, no, it's not a question. It is just on behalf of all of us to say a big thank you to you for doing such a fantastic job. Thank you for doing, for just adding to our knowledge tonight, and we so appreciate you, and to Jakkie as well. Thank you very much. We appreciate the fact that you're open for further engagement. So thank you so much.
It's a great pleasure, and thank you, Peter, for helping us put it together and inviting some of your network. So thank you, everyone. With that, I'm going to wish you goodbye and good luck, and I hope the president has good news for us. All the best, everybody.